My name is Ronald Hoffman, and I am the physician director of the Ear Institute at the New York Eye and Ear Infirmary. My favorite sound is sound that I can understand, because I appreciate how debilitating it is not to be able to understand what you hear. If you ask the question, why do people lose their hearing? Probably the greatest single factor is genetic and age-related. And then there's noise exposure. And then the third factor would be disease. I think the majority of patients as adults who lose their hearing on a genetic and age-related basis. People are going to live longer. We're going to see more of it. We have norms for hearing. I think a person should come to have their hearing tested when they begin to suspect there's a problem. And generally, the first sign of struggle is difficulty with background noise. There are other symptoms that would cause one to seek a hearing test. For example, if you had a ringing noise in your ear, which we call tinnitus or tinnitus, those people need to have their hearing tested. If people have balance disorders or they're having difficulty understanding words, that's the time to come.
My mother began having hearing difficulties, and I gently persuaded her to get hearing aids. My younger sister said, well, it may be time for you. I was 45. That was much too soon to have hearing troubles, but she gently said, just have them checked out. I had them checked out and realized that I was not participating in conversations. I'm asking people to repeat questions, and then needed to ask them to repeat it again. And then I would kind of muff a laugh, acting as if I had actually understood when I hadn't. I think if you have any question about whether you're hearing well, get it checked. Not that they have a problem, but to see if something can be done to kind of enrich the world again.
Oh, that's perfect. We know that if you're exposed to too much sound over too long a period of time, it will have an effect on you. And there is a warning that individuals should be aware of, that they have exposed themselves to too much loud sound. If you come out of a rock and roll concert and your ears feel stuffy or there's ringing, you are likely experiencing something called a transient threshold shift. That means that if we tested your hearing at that very moment, you would have a hearing loss. If we test it the next day, the hearing loss would be gone. But here's what happens with transient threshold shifts. Drop back to normal, drop back to normal, drop not quite back to normal, drop less to normal. And over time, if you have enough transient threshold shifts, you're going to end up with a permanent threshold shift, i.e. a hearing loss.
The difficult thing about having a hearing loss, it's so gradual. You think you're doing fine for a long time before you realize you're having trouble. I think that the starkness of realizing the loss is the turning point. We all have to hit that hinge point, and to be willing to listen to those people who care about us, who want to bring us back into the conversation. I think that's the main thing with hearing aids. You get to be part of the conversation again.
Many patients don't use hearing aids because they think it's going to be visible and it's going to somehow stigmatize them. Hearing aids these days are very small and they're not very visible. But what is very, very visible is hearing loss. If your friends are saying to you, Martha, did you get my fax? And you're saying, tax? I don't know you any tax. All of your friends are saying, what's going on with Martha? Is she getting demented? So hearing loss is very visible. It impacts everything you do all day long. And if you think for 1 minute that everyone in your environment doesn't know you've got some type of problem, you're really mistaken. So to wear a hearing aid that's almost invisible is not a negative, it's a huge positive. And when I couch it in those terms for my patients, they go, oh, you're right.
You feel younger. And that's a remarkable thing I did not expect. There's an energy that just comes back. Again, I get to be part of the conversation rather than shuffling myself off to the side.
I think it's important for the physician or for the audiologist to emphasize that hearing loss is a very visible disability, and hearing aids aren't.